As a first-year medical student, we're learning about the hard sciences like biochemistry, anatomy, and histology. But let's take a step away and look at how others view the medical field altogether. I conducted 5 interviews before coming to medical school about people's perceptions of healthcare, their thoughts being important, and understanding where our healthcare system stands today. For those who have been following me since day one, aka 1 month ago, I've already taken my first 2 exams at the University of Washington and have a third one coming up tomorrow. We're covering a ton of material. We're talking like 8 to 12 hours a day, 20 lectures, and 500-ish lecture slides a week. So these videos might drop a little later than when things actually happen, but I'm committed to keeping the content coming as I already have my future videos recorded. Finding time to edit has been kinda hard though. Anyways, after these interviews, I'll be doing a little analysis at the end to provide a nonsensical and under-researched solution to what's been raised by the interviewees. If you enjoyed the video, don't forget to like, comment, share, subscribe, or tap that bell notification. I'll see everyone within the next month. Take care of yourselves. Peace. Redo that. Alright.
Okay.
So getting right into it, what is your name?
Hey, yeah, so thank you for having me here. My name is Stuart Gavidia.
My name is Evan Huang.
Hey, I'm Blake Callahan.
My name is Sim.
So my name is Janess, and I'm actually a pharmacist by trade.
So I graduated with a Bachelor of Science in Computer Science, and I'm currently a software engineer at Amazon.
I have a degree in aerospace management.
I graduated with a bachelor's in biomedical sciences.
Oh yeah,
Sir.
okay.
I'm currently getting a degree in biomedical sciences at the University of Washington, Tacoma. And
As far as hesitance to seek healthcare, I don't really have too much of a hesitant, other than it's hard to find someone in Washington.
Because of cost. I've seen, even online through social media or through anecdotes from other people where they go through some sort of medical procedure and then they have to pay tens of thousands of dollars or thousands of dollars, and sometimes they have trouble repaying that back.
it just can seem kind of daunting to like approach a physician or like even just like scheduling an appointment.
I wouldn't say that I specifically do. I know there's a lot of like stigma around healthcare though. Like a lot of people of color, a lot of people of different genders have like they don't feel comfortable going to a lot of healthcare places just because of the stigma that exists around there.
Not really hesitancy or stigma, and I think it's just based off of like my background and training. I kind of know like what to look out for.
Do you get physical exams every year?
Yeah, so I try to go at least once a year. I did have I think when I was in high school, I went to a healthcare provider and they told me that men, for instance, aren't really going to get their checkups constantly. And so they really encouraged me to come in once a year. And so ever since then, I try to go once a year. And that's what I've been doing up to now.
I do not, although like it's kind of a bad look because I'm a future aspiring health professional, but I do not go to my yearly physical because, yeah, like I said to CJ earlier, I like as a young person you think you're resilient and you don't really need a physical unless you're like monitoring like maybe like a blood glucose level or something, but. Yeah, I feel like I'm in pretty good shape, so I don't need like a physical. But maybe I should start doing that. I don't know.
Yes, I do. Yeah, I feel like that's a bit of a shift though. And that does happen, right? Like when you're in your young 20s and things like that, and you're going to undergrad or like kind of just exploring life and or whatnot. I feel like the recovery period's a lot quicker, and then you start experiencing life, and one day you wake up and you're just like, what's that pain in my neck?
For like an annual physical and get normal shots, but that's about it.
Nah, I used to get physicals when I played sports in high school and in middle school, but after that they weren't required no more, and I never really went back to the doctor. I personally like to take care of my health. I watch what I eat, I work out, make sure I stay active. So I personally think I'm a pretty healthy person overall. But I don't really need the doctor there unless there's something serious going on, right?
If there's anything, like any one thing, you might have more than one thing, wish would change about healthcare, at least from your experiences, what would you say to, put on the radars of our healthcare providers?
Recently, I've taken a class called psychopharmacology, which is offered here, and that introduced me to I guess how big of a problem particular prices of like pharmaceuticals can be. There's some drugs that with them costs like $20 for like a like prescription of like a month's worth, but like outside it's like $2,000. So I think like what he's doing is like really valuable for the community. I think um, some of the bigger pharmaceutical companies could take a lesson from that.
I work in physical therapy, and the biggest problems that we as providers have and as patients, like our patients have, is dealing with insurances. Like insurances can be really complicated for no reason. Like they require the most extra stuff for no reason. We have a couple patients right now who are like dealing with shoulder tears, and they're definitely not 100% and they're not ready to go back to work, but their insurances just refuse to pay because they're like, oh, it's not medically necessary, even though we as the providers think it is medically necessary. So I can't speak for like all health, like all clinics. The physical therapy clinic I work at, if you don't have insurance, we charge, I think it's $125 per visit, and most of our patients are coming twice a week for anywhere from 6 weeks to 12 weeks to like even a few months at a time.
So something we do for our employees, I think a lot more companies should do, is provide health insurance to part-time employees. That's something actually we offer all of our part-time employees. They get the same that full-time employees do. So.
That's amazing.
Yeah,
I didn't know that.
Yeah, so
We need to start
I think,
working at airlines.
yeah, I think that would help a lot.
I know there's a couple, like NYU, for instance, got like a huge donation. They have like a program where it's just fully funded medical school. And I remember seeing like a video of those people and they just celebrate because it's just, yeah, one of the biggest things. I think also for me as well, personally, I looked into possibly going through the medical path. And for me, one of the biggest blockages was the depth that I would have to go through medical school.
Starting in August this year, the Albert Einstein College of Medicine will be tuition-free.
Access to resources. I feel like traditionally our healthcare model has been designed off of the white male, and we have to recognize and be cognizant and aware of the patient populations that we are serving. Absolutely. And how we can make sure that we are running the correct clinical studies and trials and things like that, and making sure that we're all encompassing of the people that we're treating. Now, we are definitely getting there. We've acknowledged so many different things of like the underlying subconscious racism and biases that we have, and even what we're going to do as far as like next steps in regards to that. And then even like with the genders that we're treating too, women are very much undertreated and underdiagnosed in spaces as well. But I feel like as a healthcare in general, we've acknowledged that. We're making strides to improving that.
So this qualitative study had a whopping total of 5 interviewees selected through convenience sampling, with 2 major topics emerging. On one hand, we have the financial strains of healthcare. And on the other hand, we had an inequity in people being accepted into the healthcare space. We should move away from this application of hospital hierarchy that makes physicians sometimes so scary to approach. Don't get me wrong, physicians do go through a lot to get where they are, and for good reasons do they get to where they are. But just as patients are humans, physicians are humans too. Matter of fact, you're looking at one in the making, with their corny jokes and all. Some models that are inherent in the medical system are in fact centered around historic communities that are unlikely to accurately predict risk in more modern and diverse populations. When it comes to not seeing your provider, we've heard that it can be due to a lack of availability in the area, which has extensions from there being large barriers into medical school, which I can attest to on a first-hand experience. Extending on this lack of providers, we are also facing problems with representation and primarily comfortability. I would say that the problem doesn't intrinsically lie within the skin colors of the providers that we have, but rather the cultural familiarity and the patient's feelings of comfort in being with people who come from similar background stories as them. Lastly, it wasn't explicitly mentioned, but healthcare is not beginner user friendly. It uses lots of terms that have no meaning to the common person and can further stratify itself away from the general populace through discouragingly long appointment wait times, which circles back to having a sense of healthcare shortages. Under the cost category, aka the section I have the least familiarity with, we saw that pharmacies can have outrageous prices for the layperson, which are promoted by large research times, sometimes taking 10 to 20 years to develop an effective and approved drug. These prices are further concealed by insurances. Speaking of, another issue that we heard was part-time health insurance. This is a much more complicated subject that I don't fully understand at the moment. Should healthcare insurance really be linked to employment? I have no idea, and I don't even know what to suggest as an alternative. So I'm gonna just have to put a pin in that one and return in like 2 to 3 years or ask a public health specialist, because I'm sure there's a lot of intricacies with that goes beyond just the scope of medicine, more business and economy and politics, of course. But let me know if you'd like to see some investigation into that. I can make it like a little side project. So let's take a trip to imagination land to determine some solution for some of the problems mentioned in this video, although not all of them, especially the cost related side of medicine. So I was just thinking, what if we have a more portable and accessible and reliable medical diagnostic tool that's used on the preventative side of healthcare, that should be updated and accounts for variations within people at the individual level, and allows them to retain that sense of comfortability with their provider by staying in their homes or to be put out in accessible public spaces. So don't ask me what this even means, what this looks like, what like all the details. I'm just throwing something out there. But my idea, this would look like a little biometric scanner, or even like those older phone booths that people used to use. This could help combat like healthcare shortages by moving diagnostic tools to a more machine, and this would leave more room in hospitals and in clinics for people who actually undergo procedures. And this would also allow doctors to take on a more specialized or public health social presence type of role, which could hopefully increase their reach to more diverse communities, as well as allowing them to be seen in a more friendly, positive, and approachable manner. As for funding, this in some shape or form would come from the reworked healthcare insurance system. I don't know. It's just big question marks, just kind of, you know what I'm saying, just pulling things together. Yeah. I hope you've enjoyed this little tangent. This is like super not how science works, which is why it's kind of fun to take a step away. The opinions that I've gathered through the interviews, I'm sure they do not accurately represent the majority of what people are thinking. They might in some areas, but the sample size of 5 people was super small. That's not even like, I wouldn't even use that in science unless you're doing something like on a preclinical, where you're just trying to see if things work on the biological level. Anyways, that's super. I'm cutting that out. I should cut that out because it's not relevant. So I used convenience sampling, and then I also did have to cut out some parts of people's answers just to help keep engagement on the YouTube side of things. So definitely not the most valid study, I would say. Again, this is really just done to be a little fun side project while I'm in medical school right now. If you'd like to see this done with different set of questions in a different manner, please just let me know down in the comments. I'm still just growing, so anything that I see down there is like almost 100% gonna be responded to. Looking forward to watching this video in the future and commenting on all of the possible mistakes that I've said, or how inaccurate things were, or my updated knowledge on the economy side of medicine, pharmacy, health insurance, stuff like that. Anywho, hope you've enjoyed. Catch y'all next time. Peace.